Hi, my name is Chase, and welcome to the Wellness Center podcast, where we're going to talk all things red light therapy. Thank you so much for tuning into this episode. Please make sure to like and subscribe so you can get updated and notified on all of our newest episodes that we'll be releasing. Have a great rest of your day and enjoy the episode. Hi, everyone. This is Chase, and welcome back to the Wellness Center podcast. I am super excited about today. We're going to be talking about something that I actually personally deal with, which is upper limb injury, specifically frozen shoulder or other things, or an impingement. So let's get right to it. Just for all of those who, if you've never watched this before, this is where my camera's at. This is where my computer screen's at. So I'm not ignoring you by looking this way. I'm just reading all the studies. So like always, we're going to be going over three different things. We're going to go over what is an upper limb injury, what photobiomodulation or red light therapy can do for it, and then some at-home remedies to help in the meantime or in adjunct to the red light therapy here at the Wellness Center. So let me just share my screen here. Okay, so we are looking at, and I'm going to increase the size of this so everyone can see it, sports injuries of the upper limbs. Sports injuries of the upper limbs are very common in physical activities, and therefore they need to be studied in detail, taking into consideration specific aspects of the types of sports practiced. Special attention should be paid to the dynamics of the shoulder girdle and the entire scapular belt. Since the most appropriate treatment for athletes can only be provided in this manner, this can also help to prevent reoccurrences, which can occur in some cases because athletes always seek to return to their pre-injury level of sports activity. This article will focus primarily on the management of upper limb tendon injury. So we're not going to go into any of this. This is just basically a little bit of facts about upper limb injury, so we have an idea of what we're looking at. Introduction. Upper limb injuries occur very frequently in sports and in relation to many types of sports activity. Orthopedists may need to have knowledge of their physiopathology in greater detail in order to achieve the best possible treatments. Although some sports that frequently cause upper limb injuries are not played much in Brazil, such as the specific case of baseball, for which a vast body of published studies exist in the medical literature, others such as tennis, volleyball, and handball also make great biomechanical demands on the shoulder. Such demands mean that this joint is subject to supraphysiological forces during a good proportion of the sport's movements. Here's an example. At the time of the serve, an amateur tennis player may generate angular rotation forces of the order of 7,000 degrees per second during the acceleration phase. That's crazy how fast they move in amateurs. Okay, so this is a study that was published. Let's see if I can find it. Doesn't say when it was published, but in November of 2022. And this is called the Synergy of Photobiomodulation and Myofascial Release in the Upper Limb Injuries in the Case Series. And I know this was 5, so let me go back to that. Okay. So just the abstract again, I don't want to go over all of the super incredible details for you. I just want you guys to know it works. And I also try and keep these podcasts under 10 minutes so it's an easy watch, especially on like your commute or on your break or things like that. The increase in repetitive strain injuries in recent years has led to the emergence of an epidemic character, which has become a very prevalent health problem in the contemporary world. Upper limb injuries are becoming more common, and that's not a good thing. This increase in cases come from factors related to these pathologies directly linked to the modernization of work. So this is happening more because things are modernizing and the way things are evolving, it's happening. As a means of intervention is a way to stop this. This work presents the synergy of photobiomodulation and myofascial release. The myofascial release technique, which consists of a type of massage, which applies a deep slide, muscle compressions, and frictions on the skin that act by mobilizing the muscle fascia. Photobiomodulation has direct action with analgesic and anti-inflammatory emphasis, as well as the formation of greater amounts of energy, helping disease cells and organisms to return to homeostasis. 5 patients were treated with pain in the cervical spine, shoulder, trapeze, elbow, and carpal tunnel regions. The protocol used consisted of 10 treatment sessions. 10. So we typically say a course is 12, and it typically takes 6 sessions before you notice a difference. So it just takes time. I go over that in every one of our podcasts. It just takes time. Twice a week for 15 minutes each session using an 808 nanometer therapeutic laser. So here's where we stand out. This is a laser that pinpoints a specific area, and it's 808, so one specific nanometer of wavelength of light. We use 4. And the disabilities of the arm, shoulder, and hand questionnaire dash and visual analog scale were used. There was a great evolution in the values of the disabilities of the arm, shoulder, and hand questionnaire and visual analog scale, showing that the proposed treatment is an efficient and non-invasive and non-pharmaceutical form of treatment. The photobiomodulation and massages help. All right, I just had to pause and redo the video. So I want to go back and I want to talk about some of the at-home remedies that you can do for upper limb injuries. And so the first one is splinting. You can just splint the body to allow it to heal. There's like exercise programs that you can do. Typically, I'd say meet with like someone who's an expert or trained in physical therapy, or a personal trainer, someone that can help like build a regimen for you, a safe regimen that's going to help you get back on your feet, especially after an upper limb injury. Pain management. So there's a lot of different ways that you can manage pain. Red light therapy is one of them. Cold therapy, ice pack. Heat therapy, hot shower. Transcutaneous electrical nerve stimulation. You can buy like electrical nerve stimulation stuff on Amazon. Paraffin therapy, it's a form of heat therapy. Ultrasound therapy. I haven't heard of that one before, but there's also patient and family education. Teach you a little bit about like upper body injury and the ways to recover and treat it. Massage therapy. I always am an advocate for going and getting a massage. And active and passive stretching, doing yoga, and just at-home stretches too can help with the recovery of it. So that's all I have for you guys today. Thank you so much for tuning in. I hope you guys have a great rest of your day, and I'll catch you on the flip side. Peace.